Media special report on the current COVID-19 crisis in India. I'm Jennifer Rash, and joining me is Dr. Rebecca Naylor, who served nearly 30 years as a medical missionary in India. Thank you for taking a few minutes to share with us, Dr. Naylor.
Thank you.
India, a country of 1.4 billion people, once thought to escape the full nightmare scenario of this pandemic, has now become the worst hit country in the world. With a reportedly more than 3 million active cases and more than 200,000 deaths, the country is currently in lockdown. Dr. Naylor served as a clinical surgeon and then chief of medical staff and a medical superintendent at Bangalore Baptist Hospital from 1974 to 2002. She also invested in the people and communities as an evangelist and church planter. Now serving as Distinguished Professor of Missions in the Roy J. Fish School of Evangelism and Missions at Southwestern Baptist Theological Seminary in Fort Worth, Texas. Dr. Naylor, what is it like for you to watch this news coverage?
Seeing the pictures on the TV newsreels is just so overwhelmingly sad. And I can so identify with the pictures because I know the reality of what the cities are like, what the people are like. And I'm sure probably to someone who's not been there, it just looks a bit strange, though it's obviously a dire situation. It's just very sad.
I can't imagine, all that you knew and all that you were involved in all those years. Just you can probably feel it, even
yes,
like you said, we're just watching it and it's kind of surreal. But tell us more about the people, their resiliency, what you remember about your time there.
Well, the people in India are a warm, hospitable people. Many of them, of course, live in conditions and situations that are difficult, especially in the large cities. There's so much crowding, and that is part of the very reason that the pandemic is having such a drastic effect, because in many parts of the cities, large families, extended families live together in a fairly small space. And so the virus just spreads quickly. There are people in India, of course, who are not perhaps so educated, that do not understand anything about the virus. There's much fear. There's much suspicion. Even after death, many are thinking that the disease is still communicable from the dead body.
Really?
And so that too is creating issues as people are dying and they're having to be cremated or whatever. So, I just think of all those social and demographic factors that are playing into this crisis that we're in.
Why do you think it's just now so bad there?
Last year they when we all first locked down everywhere, they did, and they had cases, of course, but nothing, of course, like this. And then I think they had opportunity, if only they could have maybe had a vaccine program or educational programs for prevention, preventive measures, all those things. If those measures could have been taken, this might have been at least not so bad. But that opportunity totally was lost. And then the virus mutated, and now it's just being transmitted so rapidly, person to person.
So if you were still there, what would you be doing? What would it be like for you?
I suppose if I were still there, I would just be like all the other people working in healthcare, doing everything I could to take care of patients who were so desperately ill.
Mhm.
They, I'm reading about manpower shortages. The healthcare system is totally incapable of coping with something this big. And even suppose they had more ICU beds and ventilators and whatever, they wouldn't have the nurses and doctors
Oh.
to staff the beds.
Mm.
And so if I were there, I'm sure I would just be working alongside everyone else, doing whatever my skills would allow me to do.
So what is the healthcare system like as far as the hospitals and all outside of a crisis? Is
The healthcare system in India is really two systems that run side by side.
Mhm.
One is the government healthcare system.
Okay.
And there are large government hospitals, there are dispensaries, clinics, and then running alongside that is the private sector. And now in India, actually, the private sector is bigger than the government sector.
Oh.
And the There only about 10% of the people in India have insurance.
Wow.
So it's basically cash payment. What's happened now with COVID um, is that the government system, of course, is far overtaxed,
Mm.
and they have instructed, mandated private entities to allocate a certain percent of their beds to government patients. In other words, a person goes to the government hospital, there's no place, and he's referred
Okay.
and he's sent to one of these private hospitals.
Hmm.
So our own hospital in Bangalore Baptist Hospital, is, having many of those kinds of patients besides the ones that just directly arrive in the hospital.
Right. Does that get into political battles and all kinds of issues that will play out in other ways?
Uh, Probably, almost surely so. But at least with when you just are faced with that many sick people, if you're the proper kind of healthcare person, you're going to respond no matter where you work, and you are going to try to help and take care.
Right. And it made me think when you said that how stretched the system is and all. And I remember back when we were sending traveling nurses and medical staff, to New York City and other areas that were hot
Yes.
pockets last year. Even if we wanted to do that with the travel restrictions and the lockdown of the country, no one's going to be able to get in, I'm assuming, on that end. So how do they deal with it without someone coming to help?
I honestly don't know the answer to that. I think I just really don't know, because if people can't go in to
Mhm.
help,
Right.
and they don't have the resources within the country, I think the only answer is it can't be solved.
Right. Wow. So as a medical personnel, as a doctor, but also an evangelist and missions minded person, how would you direct us to pray?
We need to be praying for the healthcare providers, the doctors, the nurses who are trying to meet this crisis. Many of them are sick, many have died
Wow.
themselves, and to pray for their protection. Um, in our own hospital, which is the place I'm, of course, very familiar with, staff are they're understaffed because of sickness,
Mhm.
and they are working long hours. Even the weather is a problem. This is very hot season in India,
Okay.
and no air conditioning, and wearing PPE for many hours at a time while you're frantically trying to take care of patients. That in itself is a challenge.
Wow.
And so to pray for those caregivers. I think another way that we certainly can pray is that even in this crisis, may God's will be done. May there be a great turning of people to the Lord Jesus Christ. In Bangalore Baptist Hospital, the chaplains cannot go visit the COVID patients, but they are calling them on their cell phones.
Oh, okay.
And they are having great opportunity to pray with them, to comfort them, to minister to them. And so, that in itself is something to pray for. I just think that, I just think God is going to do something great in India after all this. There's so much grief. There is so much loss. There's so much fear. And people are searching. People are going to ask questions. And when you face death, you're going to ask questions.
Right.
And so this is an opportunity. This is an opportunity for believers, Christ followers, to present the person of Jesus Christ, in whom there is no darkness. One of our workers prayed that promise that we have, that from the ashes will come beauty.
Yeah.
And I thought about all that's happening in India and all the funeral pyres as they try to burn the bodies and the ashes. Right. And God can bring beauty. He will bring beauty. And that would be our prayer. We need to pray for all of our missionary personnel who are serving in India and in South Asia, their own protection and safety. One worker talked about how do you talk to your children when you're surrounded by death, bodies, friends dying. It's everywhere. How do you have that conversation? And so we pray for our missionaries, all that they're dealing with, trying to encourage their national partners who are facing sickness and death. And, it's just monumental.
Well, and that's true, because the church workers, the pastors, the leaders, the missionaries, all of them are dealing with what you just outlined. It may be their own family, it may be themselves, it may be friends, but they've got all of the personal crises going on while trying to console and be there and minister to countless.
That's right.
Wow.
Exactly.
Yes, and we really do need to remember them and lift them up and recognize that we have a teeny inkling of what the fear is like and what the experience is like, but nowhere near what it really is for them.
And how much greater would be the fear if you had no hope?
Right. Wow. You're right. Well, and I know that various governments are sending supplies and helps, and I'm sure that some of our sending and relief efforts and those kinds of ministries that we have here will be finding ways to help as well. And so we'll keep that information in front of the audience and everybody as we find out more. But are there any other last things?
Our organization, Send Relief, our Southern Baptist organization, the international arm is very involved. They've got projects going on even now. One of the problems here is economic, and with lockdown, people don't work. And you don't work, you don't have money. And if you don't have money, you don't have food. And so food distribution projects are going on. There are a few, there are mask distribution projects that are going on. projects to provide basic health education about COVID and hygiene and all that. Those projects are happening. This is all through Send Relief. And people can go to the Send Relief International website and find the specific COVID-19 response fund for India.
Good. That's good to know that that's already being worked on and done.
It's happening as we speak, and so people can pray, they can give financially, and they can know about the projects that are happening, that we, from our churches, we are trying to send help.
Good. I just looked it up, sendrelief.org, and it's actually on the homepage, sendrelief.org. The India response is on the homepage, and you can find out more there and learn how to help. So, Dr. Naylor, thank you. Thank you for helping us just think through this and just to be able to see it a little bit through your eyes and know specifically how to pray and how to help.
Thank you for the opportunity.